Hello and welcome to or welcome back to Sharp Scratch. This is a podcast brought to you by the BMJ, where medical students, resident doctors and expert guests come together to talk about the things that we need to know to be good doctors but might not get taught at medical school. I'm your host, Zaynah Khan, a medical student in London and this year the editorial scholar running BMJ student. This is a very special episode today because I'm joined with many of my predecessors on the panel. Could I get you to introduce yourself, please? Maybe starting with George?
Hi, yeah, I'm George. So I did Zaynah's role last year, but I'm currently a final year medical student at the University of Warwick. It's lovely to be back.
Hi everyone, hi Zaynah, it's great to be back. My name's Éabha. I am a final year medical student at Lancaster in the Northwest and I was the editorial scholar and host of Sharp Scratch 2 years ago now.
Hi, and I'm Laura. I'm an IMT2 in Addenbrooke's in Cambridge.
I'm very excited to have you all with us, and I'm very excited to introduce everyone to our expert guest today, Ms Samantha Tross. Samantha, do you want to introduce yourself?
Hello everybody, delighted to be here. I'm Samantha Tross. I'm a consultant hip and knee surgeon and the first black female orthopedic consultant in the UK.
Well, I'm very excited to have you all with us today and I look forward to this episode. This episode is about surgery. So we've named it Surgical Scaries because surgery seems like quite a rite of passage in medical school almost, whether you grew up watching Grey's Anatomy and saw that going on or in whatever capacity, you kind of think of going to medical school and experiencing surgery somehow. And it's really exciting and fascinating, but often can create a lot of worries and anxieties in medical students too. So in this episode, we were hoping to try and discuss that between each other, talk about what our own fears or experiences were at medical school, and hopefully get some reassurance. I wanted to start with the panel and maybe ask about what your initial expectations were. Maybe as a first-year medical student going in, what were you thinking surgery would be like when you were going in? Can I start with you, Laura?
I had a really good experience of surgery before starting medical school. I was open with my family and friends that I was looking for work experience, things like that. And I went to visit a cousin in Norway, and he's a vascular surgeon. And he was called to emergency in his downtime. We were having dinner, and he said, "Do you want to come with me?" So on one of the evenings, a weekday evening, I went with him, and he set me up on a really high stool in theatre. So although everyone was crowded around this, I can't remember if it was a thorax or an abdomen, like it's a bit of a haze now, but I had this incredible view. I wasn't even scrubbed. That was I think that was probably my first time in theatre ever. And I was just blown away by, I couldn't really understand what I was seeing, but I was just blown away. It was exciting. I understood that what I was seeing was like a life or death situation. And it was just brilliant. So I came to medical school with this kind of impression that it could be something, an incredible sort of amazing experience. And I think my first few experiences at medical school fell somewhat short of that, actually. So I kind of went in with high expectations.
I feel like that's probably something that we can relate to. I similarly, the first time I experienced surgery was in work experience. I was with the plastic surgery. And again, like they'd put me up on the stool. I was like right in the thick of it. And I felt like so engaged and involved. And then I got to medical school and my first surgery, I was kind of just like hidden in the corner. Don't be seen, don't touch anything. Just make sure you're not in anyone's way. Yeah, I don't know, George and Éabha, did you have any similar experiences?
I was very excited. I felt like surgery felt like a big part of medical school. So before I got to medical school, I was really excited about surgery, but I had no experience, only like things I'd seen on TV. I didn't really have anyone in my family who works in medicine or healthcare or surgery. My expectations were just that I was excited and looking forward to it. I think then my first experience at med school was not the best. So I think maybe it fell a little bit short of my expectations as well. But yeah, I was very excited, really. That's all I can remember.
I was almost the opposite of all of you. I'm like yourself, George. I'm the first in my family in medicine. I didn't have any relatives or family friends in surgery, but never did any work experience in surgery. Had only ever been in an operating theatre as a patient. you know, you spend a lot of time, certainly at my medical school in the early years, on the wards and in GPs and things, but theatres are kind of bigged up to be this like big thing that you do when you get to third year. And I was just so nervous, to be honest. I was really intimidated by the physical space of the theatre and how tight the team seemed to be, how everyone seems to know each other. And I just feel like I knew nothing about it until I experienced it in real life. So that apprehension was a big feeling for me. I don't know if anyone relates to that.
That's so true. It's such a different space to other parts of the hospital, the operating theatre. And there's a sense of, you walk into that room and you think, there's definitely a way that people do things around here, and I'm not sure of what I don't know, and I feel like I could put my foot in it any second. You know, you don't touch anything because you're afraid to touch anything, and it's probably for the best in your first time in an OT, right? But the sense that there's a way of doing things, or a sort of known flow or customs or habits, even things like, you know, the huddle, which is such a sort of cornerstone of a operating day, but you don't even know what that word really means or what it's for when you first start out.
I'd like to pass this on then to Samantha. What did you feel like your first experience was? Did you know about it before you were a medical student? Like, how did it go?
I'm trying to think and remember. It was a very long time ago, I'm afraid. But I know that I was very excited and I couldn't wait to get into the operating theatre. And one of my biggest regrets was not taking a year out and doing an intercalated degree, because there was the opportunity to do that. But I was so keen, because I came into medical school wanting to be a surgeon, and I just wanted to get to the clinical aspect. And I loved my anatomy. So I don't have any recollections of my first time, but it obviously didn't. It lived up to my expectations, I think, or else it would have stayed in my mind. I can think of some negative experiences I had as a junior doctor, and they have stood in my mind. But the first time as a medical student must have been positive, because I can't remember.
I mean, that's a good way to go about it. But you said you went in knowing you wanted to be a surgeon. Is there a reason for that?
I have no idea. Apparently at age 7, I made a declaration to my family that I was going to be a surgeon when I grew up. Surprisingly, I didn't say doctor. Now, my mom was a nurse, and she worked obviously in the hospitals, and I often went to visit her, sometimes during lunch to catch up with her. So seeing her in that environment, maybe that piqued my curiosity. I know that I experienced death at an early age. My grandmother, my maternal grandmother, died at home. She was living with us. I was age 3, and that's very much imprinted in my mind as my earliest memory. And because it was traumatic for my mother, who was an only child. And then my paternal aunt also, my father's aunt also died at home, and I lost a young friend to tetanus when I was about 8. So I suspect those things played into it, and I did a lot of reading and perhaps read about a surgeon, but I have no idea where the idea came from. But at 7 years old, I made that declaration, and that's what I worked towards all the way through school and in medical school.
Wow. Do you ever think about what your 7-year-old self would say if she could see you now?
I hope she'd be happy.
She would be so proud of you, I'm sure.
Thank you.
Is there any way of knowing that you still want to stay with it, though? Because for me, the reason I didn't have any family members in medicine or anything, but my work experience in surgery was actually with the surgeon who did my surgery when I was a baby. I had meningitis, and I guess the surgeon saved my life. And in my follow-up appointments, we got along, and then they asked if I wanted to come and work experience. And even now when I go to follow-up appointments, and they're always like, you got to come and join us in a few years. But I guess when I've been in medical school, I'm a bit like, I kind of enjoy everything. I know some people go in there like, that first surgery I was in changed my life. I know that's what I want to do. Or equally, like, say, in GP placement. But for me, I feel like I kind of enjoy everything, but like a moderate amount. So how do you know that something is your calling, for example?
I say that the first thing you got to do is learn to know yourself. Because unless you know yourself, what things you enjoy, what are the things that you don't align with you, you can't really make a proper career choice. And whilst I did say, yes, I want to be a surgeon, like many of you, once I got into different specialties, I thoroughly enjoyed it. In fact, my placement prior to getting into medical school was at a psychiatric hospital. And I considered that for a time. I also really enjoyed cardiology. I enjoyed, different aspects of surgery. I've ended up in orthopedics, but I really actually developed a passion for everything I went into. And I don't think that's a bad place to be, because you don't actually really know about the specialty until you're in it. And so don't make a decision too early. And also don't be scared if other people around you have made a decision and you haven't come to one yet. Everyone has their own path. But for me, I was really good at anatomy. I excelled at that. And so I've kind of played to my strengths. I also realized that when I did my different attachments, I didn't enjoy my medical placements. I didn't like the long ward rounds. It just wasn't for me. I also didn't like chronicity, seeing patients who were unwell, and whilst everyone's doing something positive in their own way, the benefits of your intervention wasn't seen as quickly as I saw it with surgery. Certainly the aspect of surgery I was in. I mean, there are certain branches of surgery like neurosurgery where most patients didn't do too well. But in orthopedics, what drew me to it was the fact that I had the variety. I had young, old, male and female. Prior to that, I really enjoyed obs and gynae, but you have you're limited there in who you're treating. So I had the variety. I like the fact that patients who are well, apart from an injured body part, unless, of course, you're working in a trauma center. So that's something that I realized that I liked. The fact, as I said, you had that intervention, you see the benefits very quickly. I'm a hip and knee surgeon. My patients go home within a day or two now. And, there's nothing more rewarding than that. And also the first female surgeon I ever saw was an orthopedic surgeon. So I'm sure that all fed into why I chose my specialty. But I would say to students out there who are at the moment unsure of what they want to do, take your time, but spend time developing yourself. Because once you know who you are, it's then easier to make a career choice.
I guess one of the fears that students often talk about with surgery is kind of feeling a sense of not belonging. Like as a medical student, literally feeling like you don't want to touch anything and make it not sterile, that kind of thing. But more broadly speaking, like as a woman and a woman of colour, how do you feel like you found your way through surgery?
There were challenges, I'm not going to lie, and the challenges continue to today. I mean, they don't suddenly go away when you become a consultant, I can assure you. But it was that clarity of what I wanted to do. And when you are sure and you have your mind set on a fixed goal, it becomes easier to deal with the challenges that are placed upon you. When you're not sure, then somebody can sway you. So I was clear that that's what I wanted to do. By the time I became a house officer, which is what we were back in the day, and therefore the challenges, of course, there were many. There were those related to gender. And of course, there was race, and sometimes you wasn't sure what it was all about. But, orthopedic surgery of all the specialties is the least diverse. So you can imagine that it was challenging, and one was tested quite regularly. But whilst there were negative experiences, there were lots of positive. And those were the ones that really got me through to where I am today.
Can you tell us about this first female orthopedic surgeon who you met? Who was she?
Her name was Alison Hume. She was a registrar at the Whittington Hospital, where I was a medical student. And, I did not really have much of an interaction with her, and that shows the power of visibility. That even though I didn't interact with her much, I can't remember even having a conversation with her about wanting to do surgery, but just seeing her in that role made me realize it was possible. And it had a huge impact on me.
Interesting. And you remember her name to this day?
Well, we're friends now.
Oh, that's so cool.
Yeah. I think a lot of women are put off of going into the specialty because it is difficult when you don't have that visibility there as often as you like. And, as I said, in orthopedic surgery, there's still very few women around. But I really want to impress upon young female medical students out there that there isn't any specialty that is outside of your grasp. There is nothing that you're not able to do or should not, should be prevented from doing. And I don't want anyone to really be put off. Undoubtedly, you may face some negative experiences, but I think just if you can just push through, you will get into contact with some positive experiences. And I was fortunate enough that when I went into orthopedics, that I had positive experience. I know a lot of people have said that they've had very negative experiences with orthopedic surgeons. So it's a luck of the draw, isn't it? Go and have as many varied experiences as you can, and don't be put off by one negative. The culture is changing within the surgical specialty, Things are not quite where they need to be as yet, but we're certainly getting there, and we are working very hard within the British Orthopedic Association and all the surgical societies to increase that visibility and to make the workplace and culture much more inviting and encouraging everyone to feel a sense of belonging. But you will be challenges because the medicine is a microcosm of what's happening in the wider environment. And so, yes, you're going to face some negativity, some there people have biases and stereotypes. You'll feel some discrimination with regards to gender or perhaps of your color, but do not let that put you off. That's what I would say. And there are people within your, if you're in a medical school, within the medical school, or when you're a junior doctor, your education or clinical supervisor that you can talk to if you're feeling any of these negative experiences. But I would say if it's something you want to do, don't let anyone put you off. The decision must come from you as to whether you don't want to do it, not someone else.
What kind of things do you see changing?
What kind of thing? Well, I mean, we are doing a lot to try, and we're going out to schools, we're going out to medical schools, doing a lot of talks, so just increasing that visibility, doing a lot of workshops in particular surgical fields to encourage people to see what a specialty is like. And when you go to the committee meetings now, you see a lot more diversity. And we're even encouraging medical students and so on to come to, like I've just come from the British Orthopedic Association conference, and we have medical students and so on that we invite to come along. And then you have industry that's changing as well in terms of some of the tools that we use. All the tools were manufactured around men. So now industry are coming on board, and they are developing tools to make it easier for women, to make it a more accessible specialty or decision.
Interesting.
Yeah.
Really interesting.
Yeah.
I think even coming on the show and doing things like this in terms of visibility, I really hope that listeners who may be in first year and didn't see themselves represented can come and see you and feel like, wait, I can do this one day too. So, Samantha, we're calling this episode Surgical Scaries, which is a pointed way of thinking about like memorable experiences. They don't necessarily have to be scary. Maybe you've had really positive experiences. But do you have any memories from surgery, either as a student or as a doctor or as a surgeon, that really stand out to you? And could you share them with us?
I mean, I can think of a few. I mean, the very first one that stuck in my mind was when I was a medical student working on a vascular firm. And the consultant, invited me to get scrubbed up. I got scrubbed up. And all of a sudden, he said to me, "Follow." So I just stood there. I didn't know what that meant. No one had taken the time to explain that to me. Mm-hmm. So he said it again, "Follow," but a bit louder and a bit more, force in his voice. I still stood there. I looked around for someone to give me some guidance. Nothing happened. Next thing, I felt the surgical suture holder being whacked across my knuckles very forcibly, with him saying, "Follow, you idiot." Now, thankfully, prior to that, I'd had some positive experiences because that might have been a turning point in my career. And, what I learned from that is that one has to take time to educate those around you about what is required. And also it taught me very much about what kind of consultant not to be. So that was quite a pivotal moment for me there. And that one that stuck in my mind as one of my early memories. Mm-hmm. I think
what exactly was it that he wanted you to do?
So as he was stitching, he wanted me to hold onto the suture material.
Right.
Yes, but I mean, if you just say "follow," what the hell does that mean? So that really sticks out as my earliest surgical memory. But I know that prior to, because it didn't put me off, so I'm pretty sure that prior to that they were positive ones. Mm-hmm. But because of what happened, that stuck in my mind.
I think that's something that probably would resonate with the panel. I suppose it does resonate with me in the sense I luckily somehow have not had any negative experiences in surgery, but I think as a medical student going in, it's like that there's a lot of fear mongering going on that, oh, this surgeon is really mean, like make sure you know this, make sure you know that, they're going to shout at you otherwise. So I think it's really important, like what you're saying about having people who are there to explain it to you. For me, a lot of the time when I'm in surgery, I feel like the anaesthetists kind of go out of the way to kind of explain things to me. But in my personal experience, surgeons have also kind of explained. They said, okay, I'm going to ask you to sit here. What I'm doing is this. If you want to see, you can see it on this screen. Don't come closer than here because of this. And that's like helped ease my mind. But I can imagine experiences like the ones that you've had would put people off if they haven't had positive experiences before.
Yes, as I say, a lot of people have shared experiences with me that they've had in orthopedics, which I think was unfortunate. I mean, I was clear I was never going to be a vascular surgeon, that was sure. But the orthopedic surgeons were, on the other hand, was so welcoming. They made me feel as though I was part of the team. Similar to what you're saying, sometimes you felt like an outsider, you're in the way. I felt that a lot in other specialties, I must admit. But within orthopedics, they really made me feel part of the fold, and as a student allowed me to do some suturing and so on like that. And I actually felt like a surgeon already, and so I knew I'd found my home.
I think that's the kind of empowering atmosphere that you want. You want to be feeling at home and that you're being encouraged to do it. So I think that's really great. We're going to share a voice note now that was passed on from Anna, who is also a previous ed scholar, but she's currently in Obs and Gynae. And she's sharing a story that I think a lot of medical students can relate to.
As someone who now performs surgery as part of my job, I'm a trainee obstetrician gynecologist, so general surgeons don't come for me. We definitely do some surgery. There seems to be something about cesarean section that makes students feel a bit queasy. Maybe it's because a lot of surgery now is obviously like minimally invasive, which is really cool to watch. And probably, in some ways a better experience as a student because you can watch it on the screen and kind of know a bit more what's going on. Whereas like actually craning your neck to watch an open procedure can be, not very good learning experience. But I mean, I personally, in 18 months of obs and gynae training, have had 3 students faint during cesarean sections that I've been doing. And it's totally fine. Like, nobody is going to judge you or like, make fun of you or anything. So if you feel funny, then just let the staff know. But I was a bit perturbed because a couple of them happened like within a week of each other. And I'm like, is it something to do with my surgical technique that's like making all of these medical students turn green and need to sit down and have water? But I think it's just, C-sections, big open cut, isn't it? So yeah.
I can jump in there. I really resonate with that story as a student who almost fainted in a C-section. My first ever surgical experience is at medical school. We have like a medical surgical ward placement in second year, but the first time we're in theatres is during our obs and gynae rotation in third year. And so I was that student that Anna was talking about. No, we're at different parts of the country, but I have been there. And I can actually like reinforce that it's fine. No one remembers you as the student that faints. At the time that it happened to me, everyone was very lovely. I got a nice seat. I got some NHS issue biscuits. I got a lovely little glass of water. And I came back and I still got to see the actual C-section. Purely practically, all I could say to any students that are maybe a bit fainting prone is eat breakfast, eat something immediately before you go into theatre. Always be well hydrated. I made the mistake of valuing the 20 extra minutes of sleep over having a proper breakfast that morning, and I paid for it. But it's honestly, I've been there. It's fine. I'm in my final year. I passed the rotation. It's all good.
I never fainted during medical school, and so I thought I was the kind of person who that doesn't happen to. And then my first F1 job was in general surgery. And it was a brilliant surgical job. It was incredible because as the F1, out of hours, you were the first assistant. No, it was just you and the registrar in the building. So it contained a lot more actual time in theatre, scrubbed in. Again, like you, Samantha, I had opportunities to do suturing. It was brilliant. I knew at the time, I knew I didn't want to do surgery as a career. But the fact that I did a surgical skills course because I felt like in that placement I would have the opportunity to make the most of it. And my fainting story well, it actually happened in hours, and I was going to breast surgery, and I was the second assistant, and I was holding some retractors really well, and I was being ever so helpful. I passed a tool back to the scrub nurse, but I did so across the consultant's line of vision between his eyes and his hands. And so for a moment, he couldn't see what he was doing, and he was inside the breast, already sort of in a cavity. I can see you wincing, Samantha. Like it was bad. I'm feeling hot all over just thinking about it. Anyway, he shouted at me in a sort of completely appropriate way. Like it was obviously a response to the sort of like a, what are you doing kind of shout. And I was so embarrassed that I came over all hot like I am doing right now. And whilst, dressed in all the sort of the gown and mask and everything, I was too hot and I felt faint. So I had to pass, after doing that as well, I had to pass over my retractor to the registrar and sit down on the floor. And it was just the most embarrassing thing. Anyway, I had some water and I went back in for I did go back in for the second half of the operation.
The amount of emotional strength it must have taken to go back into that operation.
Well, I thought what's in terms of that sort of professional respect from my colleagues, I thought, what would be the right thing to do by this surgeon? Should I scarp it and never look him in the eye again? Or should I go back in there with my head held high and try and do my best the rest of the time and try and get what I could out of it and try and learn whatever I could? And so I went with the second one.
Good move, Laura.
Thank you.
I think that's something that is important to take away. Like, you're not going into these surgeries to, as a student, to be the main surgeon. You're here to learn. So even if you make mistakes or you feel faint and you have to take time out, just coming back and being able to bounce back, it's really the right thing to do, and it's perfectly fine.
Yes, I just want to add that it's not, as you say, it's not an unusual scenario for someone to feel faint, but you must alert everyone around to how you're feeling. That's the key. Because the worst thing for you to do is to faint over and desterilize everything around you. So no one minds if you're feeling faint, but just let everyone know and step away. But as was told to you by is that you must make sure you're well hydrated, and you must make sure that you've had something to eat before coming to theatre.
I'm happy to share an experience that really stands out for me, and it was actually the last time that I was in theatres, because it was one of those days where I was like, I'm not sure if I'm going to go. I was on my surgical block, so I was doing 6 weeks of surgery with a colorectal surgeon. So my mum had just had a right hemicolectomy 3 weeks before my surgical block, and my surgeon was a colorectal surgeon, and she was like, I want you to come in. I'm going to do a right hemicolectomy. I want you to come and see the surgery. And I was like, I think this is too close to home. I don't think I'm gonna come and watch it. But I went, and I said, I don't want to scrub in. I don't want to be anywhere near business, and I'm just going to stand in the corner. And I just told everybody before I got there, like, my mum's just had this surgery, she's got bowel cancer. But I went and saw basically the same surgery that my mum had, and I had a really good experience, and I was really glad that I went and did it. And I think for me, it was just the proof of, like, I felt really terrified that was going to be the surgery that was going to really affect me. And actually, I came out of it feeling a lot more positive about surgery than I thought I was going to. So while it was like, it kind of gave me, it was challenging because it felt close to home. But I do think there was something in just telling everybody, this is something that I might want to sit out of, I might dip out of. But I actually just stayed in the whole time. And I was really grateful to the surgeon, and I will literally never forget this surgeon, because I told her beforehand, like, I don't know how I'm going to feel about this, and she was just fantastic, and it was a really good learning opportunity, and one of those things that I'll just never forget. So yeah, it's quite, hopefully that's not too much of a miserable stance in it, but it was a bit of a learning moment for me.
What made it good? It sounds like it was quite powerful to see the same surgery that your mum had gone through, but what made the experience good?
I really detached it from the fact that it was the same surgery that my mum had. So when I went in, I was like, I'm a medical student, doesn't matter. I just put my mum out of my head, really, for that. What made it good was that the team were just really happy to have me there. I was the only medical student there. They were just very talkative to me through the whole thing. And a couple of people were like, what do you want? Do you want questions, or do you want us to talk through what's going on? It was just this really nice dynamic of open communication where I felt like part of the team. I think for all of my placements, it's those doctors, or not even just doctors, but ODPs, nurses, who just say, what is it that you want out of this experience today? What can we do? What would give you the best experience? And it was just that little bit of time. And it was just it was interesting because it was the surgical experience that I thought I was going to not enjoy the least, but find most difficult. But actually it was the thing that I was like, oh, I can see why people want to do this.
I think, yeah, not to play down the like emotional side of that, George, but I think you touched on something that really rang true to me as well, with the fact that the team like asked you whether you wanted questions or whether you wanted to be talked through things. I think the best learning experiences I've had in my surgical placements have been when teams have given you that choice, when like you can go in and the orthopod can ask you what the 4 special tests for the rotator cuffs are, or they can go in like demonstrate them for you and then you can go and do them yourself. And I think different people learn in different ways, and it's being given that choice and included in that way has made such a difference to my learning as well.
I think it can be quite a challenge as a medical student to put yourself out there and get to know the people in the room before things start. I think that's like a common thread, right, between all of our good experiences. The best stories we have are from when we felt included, when people knew who we were, when we were told where to stand, and when we were included, either through questions or explanations, just sort of signposted through the procedure at times.
No, I'm going to say that there are lots of studies that show that your performance is not so much your academic ability, because everyone who comes into medical school has ability. It's to do with the support you're given and the opportunities that are provided to you. And there's lots of research that's shown that. So that would support the stories that you've shared with us today.
So I think one thing that I'm taking away from this conversation, from the stories you shared, Samantha, and from the panel, is that there's so much more to surgery than the kind of practical element of it when you think of it. Like the things we're talking about, support from the team, or like having that resilience and confidence in yourself that even if something goes wrong, having a strength to come back and continue. What would you say are kind of the non-technical aspects that make a good surgeon or a good student in surgery?
I think you touched on quite a few of them there, but certainly, as I say, knowledge of self is very important, I think, for both a student and a surgeon. I think you've got to be able to communicate effectively. As a surgeon, you've got to be able to speak to your team, that's your medical team, but also the other team that you're working with, your anaesthetist, the nurses and so on. And you have to have a level of awareness. So whilst you're operating there, you need to know what's going on in the theatre. And you have to develop that sense. So I've got a sense when something's happening and the anaesthetist is not happy, even though I'm doing my operation. So I still have that awareness if there's something going on in the actual theatre around me. So even though I'm concentrating, I've developed that ability to really know what's happening. Knowing your team as well. So having some empathy and understanding and knowing what their strengths, their weaknesses, what their worries and fears are. That's how you're going to get the best out of the team. So I think those are the important things. And you touched on the resilience. I can't stress how important that is. And that's something that you can develop. Some people are more resilient than others, but that starts with doing work on yourself. It's about being able to sort of evaluate your day. What things went well. And this is something I do regularly. What went well today? And then, cheer yourself, congratulate yourself. Don't wait for external validation. But if things didn't go well, what can you do to make it better the next time? And I think getting into that sort of regular practice would stand you in good stead.
And I think that's applicable, say, even for a medical student in a surgery placement who maybe isn't wanting to pursue surgery later, but those skills are transferable to anything, and having that confidence and that strength to know that things can go wrong and still believing that you can improve next time. And that's going to happen throughout your career anyway, so it's good practice.
I completely agree with that, Zaynah. And actually, I'd put a pitch in there for some of the technical skills being useful beyond surgery as well. It's not something I knew in that first job doing general surgery as an F1. I didn't know that the surgical skills class would come back for me later in my other rotations. But in A&E, I was suturing small wounds, and now as a medical trainee, I got to do those those sort of
chest drains and
anesthetic drains, and it's the last step in those procedures. Even if I do everything else very quickly, if the sutures take me ages and the local anaesthetic's worn off, that patient will not thank me. Coming to be really grateful now for having some opportunities to practice suturing in that first rotation, because you hardly ever do it as a medical registrar, as a medical trainee, but they are actually really important for those specific circumstances. So even the technical stuff comes back around.
Mm-hmm. That's really useful to know, actually. I wouldn't have thought of that. I'll keep that in mind for my F1. But also to the panel, Laura and anyone else, do you have any practical tips or advice that you'd give to medical students before a surgical placement coming? Like any skills or anything that they can brush up on before even entering the OR?
I think that advice that Samantha just told us, the going into it with the mindset of, if you have a good day, congratulate yourself. You're in a very new environment. You're observing quite high level things that the people that you're working with have been doing for years, and you're like constantly soaking up information. So if you get questions right and you're doing well, like, give yourself credit for that. If you have a bad day, ask yourself what you do differently next time in the same circumstances, rather than like punishing yourself for it. I think surgery wouldn't be my top choice as a final year med student of what career I'm going to end up in, but I have learned so much from the surgical teams that I've been a part of. Yes, technical skills, but also like the way surgical teams work together, the way surgical multidisciplinary teams work together is like a model for the rest of the hospital. So I think that if you go into your placements with the attitudes of like what learning you can take from them, you'll have the best possible experiences, and hopefully the teams that you're working with will think so too.
I think one of the things that I would say to people who are just about to start, probably, I think it's kind of applicable to any placement, is to allow yourself the space, if things have impacted you, to be okay with that. And I think it's one of the things I found hardest as a medical student who's also worked in healthcare outside of being a medical student, is that when you're part of a team and you're having a bad day, sometimes you do have those colleagues who you can have a cup of tea with, or say, I'm having a bit of a rubbish day, or this has made me feel this way. And it can be harder as a medical student to have that, because you don't always feel like you're a part of the team. You don't feel like you have that kind of relationship with people on your placement, especially when you're there for like a week or 6 weeks or a day. So I think finding the things that help you feel better outside of placement. So if you've gone and seen something and you thought, wow, I found that really challenging today, or this has stirred up this emotion or whatever, like sitting with that and being okay with it making you feel a certain way, or even if it doesn't, like, that's also fine. So I think just like, yeah, finding things, if it's, I know, Zaynah, we've talked about this, like things that we do after like a rubbish day, you go home and you watch certain things or whatever. And I think it's fine to need that and acknowledge that sometimes things do come up and make you feel emotional or whatever. And I think it's like normal, and just normalizing that. So it's not really surgery specific, but hopefully that's somewhat useful.
I think this is really reassuring for someone who just integrated in humanities and now is taking a year out doing this. It's sometimes scary thinking about going back to medicine and being like, how am I going to react? But I'm definitely going to take all of this advice and take it in stride, and hopefully I'll have a really good time getting back.
A practical tip that I don't think any of us have flagged up yet is that if you know you're going to see a particular kind of surgery, it can be really useful to brush up on anatomy before you go, so you know what you're seeing. Especially laparoscopic surgeries. I remember as a medical student not understanding at all what I was seeing on the screen. Like, I couldn't orient myself very well in 3D space. So I think if I could go back and give myself some tips, I'd say it's not just enough to know like what abdominal organs are roughly where, but actually just knowing some of the ligaments or great vessels you might see, as these are sort of major landmarks, the things that surgeons are going to not want to injure. They're the kind of things that really come to the prominence in surgery. They're things that are dissected really well, identified really well, and those can be the landmarks that help you orient yourself. So ligaments, great vessels, knees and hips. I remember seeing those operations in F2, and the first time, once the joint is rotated slightly or something, just something slightly different, it's really quite a challenge to take what you've learned and rotate it in 3D space to understand how it applies to what you're seeing, especially when it's way soggier than the anatomical diagrams that you've been looking at.
Mm-hmm.
I would definitely say that, Laura, like the knees I've seen in surgery look nothing like the knees that I've seen in textbooks, and it's okay. Like nearly like the same advice, but the opposite, that don't be freaked out if a surgery doesn't look like what you pictured it would, because that's all part of the learning experience, and like surgeons understand that. So yeah, I just had no idea. It was actually a wrist for me, like seeing like a laparoscopic wrist surgery, and I was like, I don't know what anything on that screen is, because it just looked nothing like anything I had ever seen before. But I asked the surgeons and they answered me, and they didn't think that I was incompetent. They appreciated me asking the question.
I think touching on what Éabha said in terms of not being afraid to ask questions to the surgeons and not being like afraid that you're gonna appear like incompetent, like you're saying. In my experience in like orthopedic surgery as a student, the surgeons were so helpful. Like one of them was like, oh, by the way, I'm free on this day in the week and I'm like interested in medical education. If you want to help running through examinations for your OSCEs, let me know. And I thought that was so helpful and sweet. And it kind of, I feel like there's so much fear mongering in medicine. So yeah, something that I'd want the listeners to take away is that surgeons are not always scary, and you can ask for help, and they don't expect you to know everything. So don't be afraid to ask questions.
I've got a question for Samantha, if I may. I'm really curious about the medical students you've met who you remember. What kind of things, what kind of qualities did you see in those medical students that made them stick out for you? Hopefully, I mean good ones. I'm sure there might be a student who sticks out for bad reasons. I mean the ones who stick out for good reasons.
Well, the reasons that I think, I would say, turn up on time. Yeah. So if you come late, it's not gonna make. And particularly, our days are so pressured now. There's really an emphasis to get through as many cases as possible in the day, and I think that unfortunately the management don't always consider time for teaching, etc. So we are trying to do our best to fit that in. So come on time so we can talk to you adequately before the surgery. If you can. Familiarize yourself with how the theatre runs. We'll explain it to you, but you may want to speak to someone beforehand so you understand the do's and don'ts, because sometimes when under the pressure, when your surgeon is trying to explain it that time, if you're hearing it for the first time, you might forget something. If you're hearing something for a second or third time, it's more likely to stick in. So some preparatory work is important. As we mentioned earlier, read about the topic, find a little bit about the patient beforehand, and be curious. We want to get something back, and it feeds off us. When someone's interested and engaged, then it makes you feel more keen to teach and so on. So I think if you come with those qualities, then you're likely to be remembered. Enthusiasm, curiosity, punctuality.
Yeah, wonderful. I think that's a really good endpoint for like advice that students can take. But just before we end it, I did want to ask you, Samantha, what would you say is your favorite or like the most fulfilling part of being a surgeon? Or it could be multiple.
Well, it's multiple things. I mean, I certainly, being in the privileged position of being able to make an impact on someone's life and to see the benefits of that so quickly. Mm-hmm. I get a chance to interact with wonderful colleagues, and I'm involved in a specialty that's forever changing and is interesting and stimulating. So the variety, it offers variety as well. So lots of reasons to keep me interested.
Well, hopefully that's piqued a lot of interest in our listeners as well. I'd like to thank all the panel and everyone for being involved, and thank you, Samantha. I'm really honoured to have had you with us today.
It's been my absolute pleasure. Thank you for inviting me.
So I think that's all we have time for today. Thank you for everyone, and I hope the listeners at home did enjoy. If you like the show, please make sure to subscribe to keep up with our episodes. They come out every 2 weeks on Friday. Tell your friends about it, and make sure you follow us on social media. We're BMJ Student in most places, but Sharp Scratch Pod on TikTok. And until then, I've been your host, Zaynah. Stay sharp, and I'll catch you next time.